Drospirenone-Ethinyl Estradiol is a combination of two hormones, an estrogen, ethinyl estradiol, and a progestin, drospirenone. This medication is used to prevent pregnancy. In addition to preventing pregnancy, this birth control pill may also help make your periods more regular, decrease blood loss and painful periods, and decrease your risk of ovarian cysts. It's important to note that using this medication does not protect you or your partner against sexually transmitted diseases such as HIV, gonorrhea, and chlamydia. The recommended daily dosage and optimal timing for taking this medication can vary depending on individual needs, so be sure to consult your healthcare provider for personalized guidance. Make sure to read the patient information leaflet that comes with this medication, as it contains important information on when to take your pills and what to do if you miss a dose. Take this medication by mouth as directed by your doctor, usually once daily. It's best to take it at the same time each day, 24 hours apart, and after your evening meal or at bedtime to help decrease stomach upset and nausea. If you experience vomiting or diarrhea, it can affect the effectiveness of the medication, and you may need to use a backup birth control method. Your pill pack contains 21 pills with hormones and may also contain 7 reminder pills without hormones. Take one active pill daily for 21 days in a row, and if you are using a product with 28 tablets, take a reminder pill for 7 days in a row after you have taken the last active pill unless otherwise directed by your doctor. If you are using a product with 21 tablets, do not take any tablets for 7 days unless otherwise directed by your doctor. If this is your first time using this medication, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. Use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. Ask your doctor or pharmacist for information about how to switch from other forms of hormonal birth control to this product. Some common side effects of Drospirenone-Ethinyl Estradiol may include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially in the first few months of use. If any of these effects persist or worsen, it's important to inform your doctor. If you miss 2 periods in a row, or 1 period if the pill has not been used properly, contact your doctor for a pregnancy test. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the risks of potential side effects. While many people using this medication do not experience serious side effects, it may raise your blood pressure. Be sure to regularly check your blood pressure and report high results to your doctor. Seek immediate medical attention if you experience any serious side effects, such as unusual changes in vaginal bleeding, symptoms of high potassium blood level, or signs of potential blood clots. These may include sudden shortness of breath, chest pain, unusual sweating, or sudden vision changes. Additionally, seek medical help right away if you have any very serious side effects, including lumps in the breast, severe abdominal pain, dark urine, yellowing of the eyes/skin, or mental/mood changes. While a serious allergic reaction to this drug is rare, seek immediate medical help if you notice any symptoms of an allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed above. If you have further concerns about side effects, contact your doctor for medical advice. If you are over 35 years old and smoke cigarettes or use tobacco, it is not recommended to use Drospirenone-Ethinyl Estradiol. This is because smoking can increase the risk of serious health problems such as stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control. The risk of these problems becomes higher as you age and if you smoke more cigarettes. It is important to avoid smoking or using tobacco while taking this medication. It is important to inform your doctor or pharmacist if you have any allergies to ethinyl estradiol, drospirenone, or other estrogens and progestins before using this medication. Additionally, discuss your medical history with your healthcare provider, especially if you have a history of certain health conditions such as high blood pressure, diabetes, heart problems, kidney or liver issues, or depression. If you have diabetes, this medication may affect your blood sugar levels, so it's important to monitor your blood sugar regularly and inform your doctor of any changes. Also, be sure to inform your doctor if you are planning to have surgery or if you will be confined to a chair or bed for an extended period, as these factors can increase the risk of blood clots. Before undergoing surgery, make sure to communicate with your doctor or dentist about all the medications, including prescription drugs, non-prescription drugs, and herbal products that you are using. It's also important to be cautious about your potassium levels and to consult your doctor before taking potassium supplements or salt substitutes containing potassium. This medication may cause dark spots on your face and skin, and sunlight can worsen this effect. It's recommended to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you are nearsighted or wear contact lenses, you may also experience vision problems, so be sure to contact your eye doctor if needed. It's important to note that it may take longer to become pregnant after stopping this medication, and it should not be used during pregnancy. If you become pregnant or think you may be pregnant, inform your doctor immediately. Additionally, if you are breastfeeding, consult your doctor before using this medication, as it can affect milk production and harm a nursing infant. Drug interactions can impact the effectiveness of your medications and may increase your risk of experiencing serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor. There are several products that may interact with Drospirenone-Ethinyl Estradiol, such as aromatase inhibitors, atazanavir/cobicistat, fezolinetant, fosamprenavir, aspemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. It's important to be aware that drospirenone may increase the potassium levels in your blood. Be sure to inform your doctor if you are regularly taking other drugs or products that can also raise your potassium level, such as aliskiren, ACE inhibitors, angiotensin receptor blockers, heparin, NSAIDs, and potassium-sparing water pills/diuretics. Some drugs may reduce the effectiveness of hormonal birth control, leading to a decrease in the amount of birth control hormones in your body, potentially resulting in pregnancy. Examples of these drugs include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, and drugs used to treat seizures, among others. It's important to discuss any new medication with your doctor and inquire whether you should use additional reliable birth control methods. Additionally, this medication may interfere with certain lab tests, potentially causing false test results. Be sure to inform lab personnel and all your doctors that you are using this drug. If someone has taken too much Drospirenone-Ethinyl Estradiol and is experiencing serious symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help by calling 911. Otherwise, you can reach out to a poison control center for further guidance. In the U.S., you can contact your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It is important to take Drospirenone-Ethinyl Estradiol exactly as prescribed by your doctor. Typically, it is taken once daily with or without food. It is crucial to take the medication at the same time every day to maximize its effectiveness. Make sure to read and understand the patient information leaflet provided by your pharmacist, and if you have any questions, consult your doctor or pharmacist. It's important not to share this medication with others. It's important to have regular complete physical exams, including lab and/or medical tests such as potassium blood level, blood pressure, breast exam, pelvic exam, and pap smear, while taking this medication. Follow your doctor's instructions for examining your breasts and report any lumps right away. It's important to keep all medical and lab appointments. Be sure to consult your doctor for more details. If you miss a dose of Drospirenone-Ethinyl Estradiol, refer to the product package information for guidance. It is important to use backup birth control, like condoms or spermicide, to prevent pregnancy. If you have any questions, consult your doctor or pharmacist. If you frequently forget to take your pills as directed, it is recommended to talk to your doctor about switching to a different form of birth control. It's important to store Drospirenone-Ethinyl Estradiol at room temperature, away from light and moisture. Avoid storing it in the bathroom, and make sure to keep it out of reach of children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.